Hello everyone. Today we are going to discuss wheelchair and their parts, different types of wheelchairs, their indications and differences. Wheelchairs are usually indicated for people who cannot walk at all, or if someone requires assistance for walking at all the times. Someone with decreased functional endurance, such as compromised cardiovascular status, shortness of breath, or pain. Someone with weight bearing limitations, such as partial weight bearing or non weight bearing. People with poor balance who are at increased risk for falling when attempted to walk. People with compromised cognitive status who have trouble following directions as required to walk safely in their environment. There are three different types of wheelchairs: manual or standard wheelchair, which can be used indoors and outdoors; transport wheelchairs, mainly used for outdoor ambulation; and the third is the electrical or powered wheelchair, which is a heavy-duty wheelchair that requires special evaluation by a healthcare professional. Here is a brief idea of how to take measurement for a wheelchair to ensure that your patient is comfortable and the wheelchair is a proper fit for them. For seat height, take a measurement from the popliteal fossa down to the floor. If the person is using leg rest, add 2 inches to this measurement to ensure that the leg rests clear the floor completely. For seat depth, take a measurement from the posterior hip down to the popliteal fossa. Subtract 2 inches to avoid any pressure on the popliteal space. For seat width, take a measurement from one hip joint to the other and then add 2 inches to ensure enough room for clothing, comfort, and orthosis. For back height, measure from the seat up to the inferior angle of the scapula. You would want to add the height of the cushion if the patient is using a cushion at all times when sitting. The armrests are approximately 9 inches above the chair seat in a standard wheelchair. Then comes the wheelchair parts. The first part is the leg rest. The leg rest can be stationary or removable. As the name suggests, the stationary leg rest stays in the wheelchair and cannot be detached. If someone wants to get up and walk, you can flip the foot plates up to allow enough room. Removable leg rest can be detached from the wheelchair when needed using a lever usually located at the side. Elevating leg rests are recommended for the people with compromised cardiovascular function, people who have problems with the swelling in the legs or pitting edema. Adjustable leg rest comes with a knob that would allow you to adjust the height of the foot plate as well. If someone has longer or shorter legs, you can accommodate the dimensions as needed. The foot plate comes with a loop for the heels to prevent the feet from sliding. The armrests are available in full length or half length. The half-length armrest helps to accommodate the dimensions of the table for meals or recreational activities if needed. The armrest could be stationary or removable. The removable armrests are usually recommended for ease with transfers, mainly stand pivot transfers from one surface to another, such as wheelchair to the toilet, wheelchair to the commode, or when using a sliding board for transfers. You could have a fixed or reclining backrest. The manual wheelchairs, the standard types, comes with a fixed back support. The high back or reclining wheelchair is recommended for the patients with posture deviations such as increased thoracic kyphosis, for patients who have tendency to slide forward, or the people with poor neck or trunk control. The brakes could be push or pull types depending on the type of the wheelchair. An extension is recommended on the brakes for hemiplegic patients for ease in locking. The other parts are the tires and the caster wheels for movement. The rim projections are for self-propulsion. The seat belts are considered restrained nowadays and were used for people with impaired cognition or people who have tendency to slide forward in the wheelchair to minimize the risk of falling. Lap trays are also considered restrained nowadays and were available in half or full length for ease with meals and for storage. Anti-tippers are usually recommended to decrease the risk of falling in cognitively impaired patients or for those who have tendency to fall backwards upon standing. They are placed on the rear end and prevents the chair from tilting backwards. The oxygen tank holders comes with the loop and are placed around the handles on the rear side of the back support. Wheelchair cushions are of different types. The commonly used one is a foam cushion. Gel cushion is recommended for the people with compromised skin integrity or with fragile skin, people who are less mobile and requires assistance to get out from the wheelchair. A donut cushion is recommended for the people who already have an opening or a wound in their bottom. It comes with a hole in the center to avoid pressure over the site of the wound. The wedge cushion is recommended for the people who have tendency to slide forward in the wheelchair in order to minimize the risk for falling. Due to the extra elevation in a wedge cushion, it's hard for someone to stand up from a chair. It could be helpful in situations when a patient is weak with poor balance and is trying to stand up from the chair that could increase the risk of falling. Then comes the types of wheelchairs. A standard or a manual wheelchair can be used indoors and outdoors. The person can maneuver himself or herself in a standard wheelchair. The brakes are located at the front and the normal dimensions of this wheelchair are 18 inches wide, 16 inches depth, and 20 inches in height. You can customize the wheelchair based on patient needs by taking the measurements as we discussed earlier. In contrast, the transport wheelchairs are lightweighted and are mainly used for outdoor ambulation. The number of parts in the transport wheelchair are less, which makes it easy for someone to fold it and put it in the trunk for storage during outdoor trips. The wheels are also smaller in sizes that makes the wheelchair narrower compared to a standard wheelchair. The downside of the transport wheelchair is that the brakes are located on the rear end of the wheelchair and a person cannot maneuver the brakes when needed. The patient is also dependent on the caregivers for propulsion of this wheelchair. The electric or the powered wheelchair is a heavy-duty wheelchair with a rigid frame. It requires good cognition and coordination skills for operation. This wheelchair is battery operated. It's available in different types depending on the body part used for operation. It comes with hand or tongue control, with the joystick control. It has power scanning feature and it has micro switching system. Medicare requires a thorough examination of the patient by a qualified healthcare provider before a recommendation. Powered wheelchairs are usually recommended for the people who are non-ambulatory or for someone who demonstrates decreased functional endurance to ambulate on outdoor surfaces. It also makes the patient independent with outdoor ambulation as they can self-propel the wheelchair. Thank you for joining me. I hope the information provided here was helpful.